Hello, I'm Patrick Thomas, and welcome to Ladder Talks. For those of you who don't know much about Ladder Talks, you might be seeing this for the first time. This is a talk show that I do to address the issues here in Jacksonville, everything from local news to the politics and events that are worthy of discussion. I rarely ever read an article to you out of the Leader News. Most of the news that I bring to you will be from the Leader News. Occasionally there's something in the Democrat Gazette that I'll bring to you via Ladder Talks. I also host a show called Arkansas Live, where that's where I move the Arkansas related talks to and national talks of issues. Arkansas Live is a group and Ladder Talks is a page. If you don't know the difference between a page and a group, all I can say is one is just simply a page and it operates differently, and a group is something that you can join up with. A page you just click like on to get notifications. So click like on Ladder Talks page and join Arkansas Live. It is a public group, so it's open for all in Arkansas to join and view and participate in. This program and talk today is going to be specifically about North Metro closing. And for those of you who have been following some of my prior talks, I've been really busy and doing a lot of research on various subjects. I've been writing letters to the editor. I've been on the phone to people. I've been in private meetings, and I have missed some Ladder Talks. I'm trying to get caught up. And I think sometimes there's a reason, because some things are very important and I'm trying to get my facts straight. I sometimes think things are factual, or somebody says they're factual, and I find out that they were close to being true, but they just weren't exactly right. In the Wednesday, August 21st Leader News, if you don't have a copy of it, I don't know if you can find one at the Leader if you want to get your own copy. And I'm here to tell you right now, Leader News does not pay me to mention their paper, and I always plug them because I think they've got a good deal going on, and they're going to keep a Wednesday, Saturday subscription going for you in paper form to keep you informed. While some of the big guys are going electronic and Sunday only papers, I like the paper edition. I can handle it, and it's just great. And I appreciate the Leader News. But for $19.87 per year, you do a 3-year subscription, you can get a subscription with the Leader News. Let's just call that $60. If you get a 1-year subscription, it's a little over $30. So you're saving about half the cost. And if you drop 50 cents in the box, you're paying about twice the rate to drop it in the box. So let's get right into the North Metro closure. And I'm going to start out with a letter to the editor that was written, I say it was a letter to the editor. It was editorial, and sometimes you don't know who's writing the editorial. It could be any of the editorial staff, including Mr. Feldman. This particular letter to the editor, since it's already out, I'm going to read the entire letter to the editor to you. Normally I don't read entire articles, but if this would have been today's paper, I want you to go buy your own paper. I'm not going to read today's paper to you, but this is old paper material, so I don't mind. It's not even in the boxes anymore, so I don't mind reading it, okay? I want you to buy a paper. This is on the rumors of the hospital closure. Before I get to the talk, there's always a rumor mill, always a rumor out there about this or that, but the local rumorists almost got out of hand. The rumor was that North Metro emergency room was closing. Rumors about the Jacksonville Hospital closing have floated around for years as wishful thinking for many. Yes, the hospital is on financial shaky ground. We've documented that often, and we've questioned the skills, sobriety, and legality of some of its staff throughout the years. There was even a time and a date attached to the rumor. It was a rumor that could have got someone killed. The city's ambulance service was on alert to bypass North Metro ER when it closed. But it never closed, and if any ambulance or a scared parent with a sick or injured family member drove past the hospital because of the rumor, well, someone could have died. We called the mayor and others that would be in the know. They heard it too and weren't sure what was going on. Calls to the hospital's main line and emergency room went unanswered, adding fuel to the rumor. That's when we went to the principal owner, Rock Bordelon, CEO of Allegiance Health Management out of Shreveport. Bordelon has a hate relationship with the newspaper because of our close monitoring of the hospital. But if anyone would know if something was closing, it would be the main owner. A call went unreturned, but after sending a text, he responded. Business as usual. Case closed, rumor busted. Might the ER or hospital close in the future? Maybe, but it didn't last week, and we all need to do our due diligence to ensure no one dies over a rumor. Mayor Bob Johnson is doing everything in his power to keep the hospital open. His late father, Dr. Albert Johnson, helped open Rebsamen Hospital, North Metro's predecessor, in 1962. Those were different times, but the hospital is needed as much as ever. Someone, Baptist Health, UAMS, wealthy benefactors should step forward and ensure the hospital's future here for another 57 years. Now, folks, I'm going to speak to the editorial here just briefly. Back in the day, in 1962, when Jacksonville was the only place to go on 67-167, all the other hospitals were over in North Little Rock. I mean, they were in Little Rock, in North Little Rock. They were not just right down the freeway. We didn't even have a freeway in 1962. So it flourished, and it meant that everybody in Jacksonville would go to that hospital. Now, I have talked business talks before about what happens when you have more choices and you have transportation systems that can get you places quicker. And when you have transportation such as 67-167 and you can do 70 miles an hour to the freeway or to the hospital, now when you have Baptist and St. Vincent's North being in Sherwood and Baptist down at Spring Hill, you not only have more choices, but it means when you make that choice, that is one less person going to your local hospital. Now, I realize we all have our choices and we all formulate our opinions, but I'm here to tell you that when you're in business, if you don't manage your business model to stay with the times, and if you're not big enough, North Metro is a rinky-dink hospital, folks. The owners they're not Baptist, they're not St. Jude, they're not Vincent's. Those are huge hospitals, and they can absorb the cost, and they have the HR departments where they can be very, very selective to make sure that you have the best in personnel offering you those medical services. When you're some little rinky-dink operation and it comes to the medical and emergency rooms and that sort, if you make one mistake, your competition is just 9 minutes down the road. You may have just lost out on a patient, and you do that over and over and over again, and your attendance, your ability to pay your bills is going to decline because you have less cash flow. Okay, so North Metro was another casualty. I think I used that word in another video I did. North Metro is just simply another casualty to us here in America having choices. So That's your business lesson on how North Metro ended up coming here and how they ended up dwindling in their patrons, their patients. If I ever needed a Band-Aid, I might go over to North Metro. If I was in a car wreck and I had a broken leg, I'm not going to die. I would probably go to North Metro. But folks, I tell you, if I felt like I was having a heart attack, no. If I feel like I can make it to North Metro and maybe my wife drive me there, or Spring Hill or St. Vincent's, and my wife can drive me there, or even if an ambulance came to get me, I would have probably said, you take me to Baptist or the VA or St. Vincent's. And I think a lot of people felt that way. I wasn't very confident beyond Band-Aids, broken bones, and stitches that emergency room could take care of the problems. Now, if any of you are working there and you took offense to that, I'm just sorry to tell you, that is a good example of how a lot of people felt about North Metro. They had another choice. And depending upon the circumstances of the timeliness required to get there, they would make a choice to go ahead and just go south and go to North Little Rock for services. So, here we've got an opinion that was published and what some would say a lie. I hate using the word lie, folks. I often tell people, don't use the word lie. Use the words, they didn't know what they was talking about. I often say some things sometimes that somebody eventually want to come around and say, well, you just didn't know what you was talking about. Don't call me a liar. I take offense to that. It's almost like calling me a racist or something like that. If I don't know what I'm talking about, I'll fix it. But just don't call me a liar. So let's move to, there's two stories in today's Leader News, Saturday, August 24th. City seeks to reopen the ER. And I may not even, I've got some highlighted areas here that I'm going to go ahead and read. Let's see, nothing really I want to mention on the front page, but under the City seeks to reopen ER, under that page, there's some comments. A month before its closure, the hospital had a state inspection based on a patient complaint. The hospital was found to be in violation of patients' rights on 2 counts. You could probably go to St. Vincent's or Baptist and have patients' rights violations. Somebody didn't give you the form or give you the briefing or get you to sign something, or even if it got signed, it may have got lost. I don't know, but that almost sounded petty. 2 violations of patients' rights. An inspection team came over July 30th, and after interviews and interviewing patient records, it determined the hospital failed to provide patients with a notice of rights. That doesn't concern me. Another area, the hospital also failed to establish a process for prompt resolution of patient grievances. Wow. I think we've got other entities in the surrounding Jacksonville area that has problems satisfying grievances. Okay, so that's nothing unusual, having problems satisfying grievances. There's a lot of grievances, and too many times people just say, go away, you're bothering me. Another highlighted area, before Boulder Lawn bought the hospital, the ER was handling about 1,500 to 1,700 patients a month. Now it's down to 500 to 700 patients, especially when Spring Hill Baptist is running around 3,000 patients a month through the ER. Jimmy Durham said that in interviewing with Jimmy Durham. So those numbers could be off a little bit, but it makes the point that I made earlier about the editorial. As your support dwindles, so does your cash flow and your revenue and your profits, and you have a hard time paying your bills. Folks, North Metro had a hard time paying their bills. They were suffering from lack of payouts from the government. They were suffering from people going into the emergency room and having to write off services because people didn't have insurance. Medicare, Medicaid, they pay lower then apparently, according to the story, they pay lower rates than the psych unit. They still have the psych unit up and running. It's more profitable. They don't want to let that go. That's probably their profit center, the only one that is profitable, and they're hanging on to it because apparently Medicare and Medicaid, one or the other or both, apparently they pay more. Well, they may have flea flicked, often say you flea flick stuff, they may have flea flicked the hospital and emergency room because those folks don't have insurance sometimes and they end up being a liability, and Medicare and Medicaid doesn't pay off as well. Everybody else that has insurance might be going elsewhere. I don't know. Last year, the Jacksonville Fire Department transported more than 1,100 patients to North Metro out of 2,960 transports to all facilities. So let's just say roughly about a third, okay? St. Vincent's North is now our closest CER facility. That is 9 minutes from our city, and Spring Hill Baptist is 13 minutes. He expects the closure to increase patient transports outside the city and increased wear and tear on equipment. I think that was said by one of the fire department representatives, one of the captains. According to Meg Mirabel, spokeswoman for the State Health Department, North Metro is now licensed as a psychiatric hospital as of August 20th. They changed their license, from what I understand. Psychiatric hospitals are not required to have an emergency department. According to Anderson, which I'm going to come back and say something that Leader News didn't say. Dale Anderson, I believe is his name. According to Anderson, North Metro is well on its way to putting the pieces together utilizing a micro-hospital model, hybrid, a new way to deliver high-quality, cost-effective, sustainable healthcare services. Folks, I'm here to tell you, I don't think the residents of Jacksonville are going to have a favorable taste in their mouth after this experience to want to give them even a micro hospital model. I think they're foolish for thinking that that bunch of investors and that bunch of managers, I don't think those folks are going to be able to get it off the ground. I just don't see it happening. Everybody's going to be pretty upset over this, including, I don't think they're going to get anybody to work for them. They gave them no notice whenever they terminated them. I'm going to talk about that here in just a minute. You're going to find that little tidbit interesting. But all are independent businesses only renting space from Allegiance, referring to all the satellite things that is going on over there. It's more than just this one group. They've got others who are renting space and they're running. Some of that hospital is the psych unit and our care, family medical clinic. Apparently they are part of North Metro building somewhere in there. I haven't been over there in years, really. I'm wondering if they are tenants paying now money to the owners of the hospital. I'm under the impression from some other research that I've done that these folks who have closed the hospital, that they bought the property and they are owning the property they can rent. Used to, the city of Jacksonville owned the property and they had a hard time collecting rent. So I guess somebody on the board probably told them, you need to buy the building because we're tired of collecting your rents, and let the banks collect the payments. So that's all I'm going to say about the story. City seeks to reopen ER. Now I'm going to get over to an article written by Mr. Feldman, the chief editor, owner of the Leader News. I like his boldness in his title. Sleazy operator ruined hospital. He's starting to sound like me sometimes. I've got a certain appreciation for sleazy operator. I'm going to read this first paragraph here. If we had a more rational healthcare system, there would be no place in it for the likes of Rock Bordelon. Mr. Feldman goes on to say, and most of his hospital employees, I guess I better back up here because that didn't make sense to me either. But let's see, shut down North Metro's emergency room and pretty much the entire hospital at midnight Tuesday without much advanced warning. He fired his emergency room staff and most of the hospital employees, endangering the lives of patients who had to be transported. Again, I'm going to talk about this other subject related to the hospital and the notification.